Naproxen, also known as Aleve, is used to relieve pain from various conditions such as headache, muscle aches, tendonitis, dental pain, and menstrual cramps. It also reduces pain, swelling, and joint stiffness caused by arthritis, bursitis, and gout attacks. This medication is known as a nonsteroidal anti-inflammatory drug, NSAID. It works by blocking your body's production of certain natural substances that cause inflammation. If you are treating a chronic condition such as arthritis, ask your doctor about non-drug treatments and/or using other medications to treat your pain. Be sure to check the ingredients on the label even if you have used the product before, as the manufacturer may have changed the ingredients. Also, products with similar names may contain different ingredients meant for different purposes. Taking the wrong product could harm you. The recommended daily dosage for Aleve is based on the condition being treated and should be taken with food or milk to prevent stomach upset. It is typically taken every 8 to 12 hours as needed for pain relief, and the best time to take it may be in the morning. Always follow the directions on the label or as directed by your doctor. When taking Aleve, it's important to follow the directions on the product package if you're using the over-the-counter product. If prescribed by your doctor, be sure to read the medication guide provided by your pharmacist before starting this medication and each time you get a refill. If you have any questions, don't hesitate to ask your doctor or pharmacist. Take Aleve by mouth as directed by your doctor, typically 2 or 3 times a day with a full glass of water. Remember not to lie down for at least 10 minutes after taking this drug. To avoid stomach upset, take Aleve with food, milk, or an antacid. The dosage of Aleve is based on your medical condition and response to treatment. It's important to take it at the lowest effective dose for the shortest possible time to reduce the risk of stomach bleeding and other side effects. Do not increase your dose or take this drug more often than directed by your doctor or the package label. If you have ongoing conditions such as arthritis, be sure to continue taking Aleve as directed by your doctor. For certain conditions, such as arthritis, it may take up to 2 weeks of taking Aleve regularly until you get the full benefit. If you are taking this drug as needed, remember that it works best if used at the first signs of pain. Waiting until the pain has worsened may result in the medication not working as effectively. If your condition lasts or gets worse, or if you think you may have a serious medical problem, seek medical help right away. If using the non-prescription product to treat fever, consult a doctor immediately if the fever worsens or lasts more than 3 days. Some common side effects of Aleve may include upset stomach, nausea, heartburn, headache, drowsiness, or dizziness. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. If your doctor has prescribed Aleve for you, it's because they have determined that the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. Aleve may also raise your blood pressure, so it's important to monitor it regularly and inform your doctor if the results are high. Seek immediate medical attention if you experience any serious side effects, such as easy bruising or bleeding, difficulty swallowing, changes in hearing or vision, signs of kidney problems, unexplained stiff neck, symptoms of heart failure, or any symptoms of liver damage. Although rare, a serious allergic reaction to Aleve can occur. If you notice any symptoms of a serious allergic reaction, seek medical help immediately. This is not a complete list of possible side effects, so be sure to communicate with your doctor or pharmacist if you notice any other effects. Taking Aleve, which contains naproxen, may increase the risk for a heart attack or stroke, especially if taken for a long time. This risk may be higher for older adults or those with heart disease, high blood pressure, diabetes, or a family history of heart disease. It's important to avoid taking Aleve right before or after heart bypass surgery. There is also a rare risk of serious bleeding from the stomach or intestines while taking Aleve, especially for older adults. If you experience severe stomach pain, black/tarry stools, or vomit that looks like coffee grounds, seek medical help immediately. If you notice any of these rare but serious side effects while taking Aleve, such as chest pain, shortness of breath, weakness on one side of the body, or sudden vision changes, stop taking the medication and seek medical help right away. Before taking Aleve, be sure to talk to your doctor or pharmacist about the benefits and risks of taking this medication. And always follow the recommended daily dosage and the optimal timing for taking Aleve. Before taking Aleve, it's important to let your doctor or pharmacist know if you have any allergies, especially to aspirin or other NSAIDs. Also, be sure to talk to your pharmacist about any inactive ingredients that may cause allergic reactions. Discuss your medical history with your doctor or pharmacist, especially if you have asthma, blood disorders, heart disease, high blood pressure, liver disease, or stomach/intestinal/esophagus problems. It's important to stay hydrated while taking Aleve, especially if you are an older adult or have heart failure or kidney disease. If you notice a change in the amount of urine, be sure to contact your doctor. This medication may cause dizziness or drowsiness, and using alcohol or marijuana can intensify these effects. Avoid driving or using machinery until you know how this medication affects you. Daily use of alcohol and tobacco, especially when combined with this medicine, may increase your risk for stomach bleeding. Limit alcohol and stop smoking. Be cautious of sun exposure while taking Aleve, as it may make you more sensitive to the sun. Also, some products contain sodium, so be sure to inform your doctor if you are on a salt-restricted diet. Before having surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. For women of childbearing age, it's important to discuss the benefits and risks of taking Aleve with your doctor. If you are pregnant or plan to become pregnant, consult your doctor before using this medication. Aleve may also pass into breast milk and have undesirable effects on a nursing infant, so be sure to consult your doctor before breastfeeding. When taking Aleve, it's important to be aware of certain interactions with other medications. This includes drugs like aliskiren, ACE inhibitors, angiotensin II receptor blockers, corticosteroids, lithium, and diuretics. These interactions may change how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Additionally, Aleve may increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. It's important to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers that are similar to Naproxen and may increase your risk of side effects if taken together. If your doctor has directed you to take low-dose aspirin to prevent heart attack or stroke, you should continue taking the aspirin unless your doctor instructs you otherwise. However, daily use of Naproxen may decrease aspirin's ability to prevent heart attack/stroke, so it's important to talk with your doctor about the risks and benefits. It's also important to be aware that taking Aleve may interfere with certain lab tests, possibly causing false results. Make sure lab personnel and all your doctors are aware that you use this drug. If someone has taken too much Aleve and is experiencing severe symptoms such as passing out or having trouble breathing, it's important to seek immediate medical attention. You can call 911 or your local poison control center for assistance. Symptoms of an Aleve overdose may include severe stomach pain, extreme drowsiness, or seizures. It's important not to share Aleve with others. Your doctor may also recommend lab and/or medical tests while you are taking this medication. These tests may include blood pressure, complete blood count, and liver/kidney function. It's essential to keep all medical and lab appointments and consult your doctor for more details. If you have arthritis, lifestyle changes such as weight loss if needed, and strengthening/conditioning exercises may help improve your flexibility and joint function. Be sure to consult your doctor for specific instructions tailored to your individual needs. If you are taking Aleve on a regular schedule and you accidentally miss a dose, take it as soon as you remember. If it's close to the time of your next dose, just skip the missed one and take the next one at your regular time. Do not take a double dose to make up for the missed one. It's important to keep Aleve at room temperature, away from light and moisture. It's also crucial to store it in a place that's out of reach of children and pets. When you no longer need the medication or it's expired, make sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. And remember, don't flush Aleve down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.